The Pareto principle, as related to nursing case management, indicates that A. Resource allocation must be multidisciplinary to be cost-effective. B. A systematic and dynamically adaptable framework is required. C. About 80% of all health resources are used by 20% of the population. D. No professional discipline owns the practice of case management. The correct answer is option C. The 5 components of a nursing case management framework identified by the American Nurses Credentialing Center are: A. Planning, organizing, coordinating, advocacy, and monitoring. B. Assessment, planning, implementation, evaluation, and interaction. C. Communication, planning, facilitation, advocacy, and monitoring. D. Evaluation, linking, coordination, advocacy, and monitoring. The correct answer is option B. Client assessment in case management is best described as: A. Completion of a thorough physical exam to identify all health issues. B. Interviews of collateral contacts to understand the client better. C. A thorough client interview to evaluate identified needs. D. An in-depth evaluation, including interviews and record reviews. The correct answer is option D. Case management systems should be adapted to accommodate all of the following except the: A. Political or cultural views of the case manager. B. Organizational setting in which the services are provided. C. Socioeconomic needs of the population being served. D. Developmental characteristics of the clients being seen. The correct answer is option A.